You'll remember in our previous trainings, we covered the CFC system, the continuum of care system, and it was primarily focused on CFC, meaning the CFC program or funding system that supports many of the projects, the component types that staff on this training group operate or are part of. So coordinated entry, emergency shelter, outreach teams, transitional housing, rapid rehousing, PSH, sometimes specific services. All of that is included in the CFC system. And we spent that first training just wanting to have some kind of foundational elements. We talked about the point in time count and system performance measures, all to just make sure that everyone has a scaffolding of similar understanding that we could build the remainder of the content around. Then we switched to intake assessment and housing plans on our second training. That was really about that first engagement and collecting and managing information about participants as they're either being assessed or entering programs. Make sure that we're managing that information in an appropriate way and using that information to support the pathway to resolution or crisis resolution, whatever that might look like for individuals. Then our last training was focused on trauma responsive care and client-centered practices. We talked a lot about how trauma kind of presents itself differently in different circumstances and with different people, and how as direct line staff and case managers and care coordinators throughout Rhode Island, you might encounter trauma from the participants that you're serving and how we might manage that to support people in their resolution. Today, as I said, we're talking about housing-focused practices or housing first. That's going to be a sort of a foundational element that runs through this training, and in our next training focused on how to engage and support the housing resolution or the crisis resolution of what we're calling hard to serve clients, or clients who have higher levels of acuity, more challenging barriers to resolution. Those same housing focused practices or housing first practices are going to be deployed in that hard to serve client. So there will be probably examples that come up today that might fit into the category of, well, this is probably a hard to serve client or a more challenging case or something that's going to absorb more of your attention and might require, some supervisory support or going to some peers or team members to help just sort of brainstorm, what do I do when I get these really challenging cases? That will come up today, but we'll focus on that in our next training. And then we'll sort of round this out in an in-person training on July 21st. I'm looking forward to the opportunity to seeing everyone in person. And we're going to review quickly all of these fundamentals that we've been talking about for the past several months, and then actually review live cases or actual cases that the Housing Innovations team has encountered from our work in other jurisdictions. And we'll explore collectively as a group how we might address those cases. So we'll actually start practicing some of these assessment techniques, client-centered practices, housing first, and then motivational interviewing, trauma-informed care. All of those will be deployed in the in-person workshop later in July, just a month from now. So that is our schedule, but today it is housing-focused practices. We're going to focus on the general approach to housing first. What does that mean? I think the term gets a lot of airplay, and sometimes because it's so commonly used, it sort of gets a little bit blurry in terms of the specific definition. So we're going to apply some very precise definitions around what we mean when we say housing focused or housing first. And try and clear up some of the ambiguity around what actually constitutes a housing-focused approach. And when something like just housing first is a label that gets applied to something, and maybe it sort of plays out publicly in a way that's not consistent with the true practice of housing first. We'll talk about how you deliver services in a housing first approach or a housing focused approach. We'll talk about some specific case studies. We'll actually practice or kind of brainstorm. What would you do? How would you apply these housing-focused approaches or techniques in live cases? There's no absolute correct answer, so it's just an exploration of how to understand these concepts. And I'm always surprised in each of these trainings that we do. We always have kind of general thoughts about how, in these cases that we present, what a likely kind of scenario or a pathway might, how that kind of emerges. But the participants, you all, have always presented really interesting ideas, and so it benefits from a group discussion. I'm really looking forward to that aspect of the training. So that's our agenda for today. Whoops, there we go. So, in our previous trainings, and I reviewed all this, we talked about engagement and assessment, building motivation and goal setting, and we provided some tools, some sample goal plans, and sample assessment forms. We'll also use those in our in-person training next month. But if you have questions about those, sometimes it takes, maybe just a little bit of time to kind of digest them. If you print them out and look at them, compare them to tools that you're using currently. So if you do have any questions about those previous trainings or the tools that we presented, trauma-informed care, CTI, if any of those things, if you have questions about, they're certainly welcome in this setting. We don't have to, just because we're moving on to Housing First, doesn't mean that we can't revisit some of these if there are questions. So make sure if you have something that's either still a little bit kind of blurry, or you're having an opportunity to apply it in a real life setting and you have an example or a question, that's always welcome to bring up in this setting. So make sure that you're sharing those examples or raising those questions if you have them. Okay, so let's talk about Housing First. It's, as I said before, the term we're using for the training officially is Housing Focused, but essentially it is Housing First. This is a homeless assistance approach that prioritizes providing permanent housing to individuals and families experiencing homelessness without preconditions like sobriety or treatment compliance. And that is essentially it. Housing is provided as an initial response because the fundamental crisis is people do not have a home, they're unhoused. So we address that immediately by providing a safe, appropriate housing intervention. But it doesn't mean that services are not paired with that housing. And that's often sort of a misconception about housing focused approaches. It's based on the concept that stable housing is the foundational kind of human right. And it's also a necessary element that allows people to then address other issues that are going on for them or other barriers that they might have in their life. But it doesn't mean housing without services. And that's sort of a really the kind of one of the headlines or the take-home messages of this training. Housing First is not housing only. It's an initial intervention of housing that's paired with appropriate services so that individuals and families are able to maintain that housing, improve their self-sufficiency and their well-being over time. Housing First prioritizes this immediate access to housing, but it also prioritizes participant choice and self-determination. The participants in the programs are actively engaged in helping to identify what it is that are their primary interests and what issues they want to have help resolving. People don't have to demonstrate that they're ready for housing or that they deserve housing. It really is approached as a fundamental human need and a human right. And then, as I said, we're pairing the services around the housing foundation. The most common misconception around housing focused approaches is that it is housing only and that there aren't the services. So that is definitely a message that I want to make sure we all sort of take away from this training. So let's review the core principles of housing first approach. The first is that this low barrier access. And what do we mean by that? It means that everyone is housing ready. And in a housing focused approach or a housing first approach, there's not a group of clients they're not quite ready to move into housing. They're not eligible. They haven't demonstrated enough need, or they haven't demonstrated the capacity to manage an apartment or a home setting on their own. we approach this, the sort of way into this is that everyone is ready for housing, but then the services are going to be sort of titrated, more intense or more moderate, depending on the needs. So we never would approach a client and say they're not going to be housed because they have to address other barriers like a behavioral health, a mental illness, substance use. They have to get a job. They have to agree to participate in parenting classes or maybe take a budgeting class, and then we'll house them. We always start with the housing first. There are no exclusion criteria. In very rare cases, and this is very rare, narrowly defined, there might be issues where there's a physical health issue that must be addressed. And so there might be an interim step, but it's always some kind of residential component. So it might be some assisted living, or it might be a medical model that has an intensive kind of clinical, a medical approach. But those are the only instances where the housing would be dependent on some kind of additional exclusionary criteria. But for the vast majority of cases that we're talking about, everyone is able to be housed, and we start with that is right out of the gate that housing is an initial intervention paired with the appropriate amount of supportive services. The only admission criteria or admission criteria that we're applying for projects are those eligibility criteria that are dictated by a funder. So that is also part of this low barrier access foundational element. If, for example, it's a resource that's a housing focused for veterans, then obviously the person would have to meet the VHA eligibility criteria in order to gain access to that housing resource. So that's an eligibility-based requirement. It's not dictated by us. It's the funding source that operates that VA housing. So those are the only instances where we apply any kind of criteria. It's based on admission criteria that are dictated by a particular funder. The second core principle that I want to touch on is this community integration and recovery. Housing is not kind of an institutional setting that's set apart and different from the community. It's integrated into the community. I'm just I'm scanning just wanted to make a quick look to see if there's any questions in the chat or if there's any hands up, but I'm not seeing these, so I'm just going to keep going. So the community integration means that housing works best when it's a kind of home-like setting in a natural environment like a neighborhood, not an institutional setting. It has to look and feel and operate like other housing. And that's ultimately showing sort of respect for the individual, that they deserve to live just as other people do, just as you and I live, in a sort of a natural environment, in a neighborhood, in a community that is aligned with or connected to their choice or their desire about the kind of community where they want to live. It enables people in community integration to participate in meaningful activities that are appropriate or aligned with their interests. It helps them build relationships to maybe if it's daycare in the neighborhood, or they're looking for employment in the region where they live, or they have neighbors or friends that are part of their social network, and we want to support that. So this community integration piece is really critical to the housing first approach, and helping people develop personal and social relationships, family and community relationships are going to support housing stability in the long term. The third element, after we talk about low barrier and community integration, is lease compliance and retention. And this is also kind of one of the misnomers of housing first, is that this often described as sort of anything goes, and people can do whatever they want, and housing first means you can never get evicted. There's no consequences for bad behavior or poor choices, and that is not the case. Participants in a housing first project must sign a lease or a program agreement just like everyone else, and there are consequences when they are in non-compliance with that lease agreement or their program agreement. So the standard of maintaining the lease, paying the rent on time, maintaining the unit, allowing or supporting an environment of quiet enjoyment for your neighbors, all of those apply, and participants in a housing first project are also subject to those expectations. We provide the services that enable people to comply with those expectations. So making sure that they understand the terms of the lease, that they're engaged in kinds of behaviors that are minimizing risk or addressing what might have caused conflict in the past in their housing arrangements. But the focus is on housing retention, and everyone must follow the terms of the lease. The lease is actually a really helpful tool that provides structure and expectation around how people are going to manage their lives. And that is no different for a participant in a Housing First project compared to just the general population. The fourth Housing First approach principle is the separation of housing and services. The property management is in a perfect world is separate and apart from the service provider. So it's not the landlord that's providing the services. Those are two different entities. So the property management company or the landlord or the entity that's managing the housing is separate and different from the entity that's providing the services. And that's really useful because we don't want to sort of conflate or blend those two where the participant is nervous or reticent or maybe dissuaded from engaging in services because that service provider is also responsible for ensuring that they comply with the terms of the lease or their program agreement in their housing. So when those two roles, when the services and the housing roles are integrated or conflated, it leads to less engagement from the individual and blurring of responsibilities and confusion, and oftentimes reticence of the individual to engage or ask for help because they feel like it might lead to losing their housing. And so if they're struggling with the terms of their lease, maybe they're behind in their rent, there's issues around how they're maintaining the unit, some hoarding activities, or maybe they're having too many friends visit them. Those are issues that the service provider needs to address, but do that in a way that separates from the housing provider or the property management, so that the client in the project is willing to engage and explore how their behavior is maybe risking or creating some challenges for the lease expectations. And they can participate in maybe exploring some behavioral changes or adjustments in a way that's productive. So those are the four sort of foundational elements of Housing First. We also just want to reinforce that tenants learn by being treated as other tenants. They're no different from other tenants. And it's also in an effort to not pathologize being homeless. Just because you're homeless doesn't mean that you're not able to manage the terms of a lease. And we don't want to kind of suggest that homelessness itself is some kind of disability that requires sort of specialized supports and services. The services are really around either disabilities that are part of the household, housing barriers that exist, and we're just trying to manage them in a way that allows them to maintain the unit. And the other kind of reason that it's important, these barriers, is that problems with tenancy or the lease are going to motivate the client to engage in services and use those services if there's separation, as we've said. So those are the core elements. Now let's talk about how these get kind of operationalized and how these play out in regular cases. The standard lease in a housing focused approach or a housing first approach, tenants are encouraged to sign a lease, or sometimes there's a program agreement if it's a transitional housing project, or maybe it's another project that doesn't actually have a lease, or there's this kind of a sublease. But the idea of the lease is a really critical piece. It provides structure and expectation around the terms of their living arrangement. And we use that lease, we use the information, the expectations, the requirements of that lease to engage the participant in what are appropriate behaviors that are going to support housing retention, and behaviors that are inappropriate or behaviors that are going to risk their housing. So that lease is really an important foundational document. The lease is organized according to these kind of components: immediate access to housing. So there's low barrier. They don't have to get a job first. They don't have to demonstrate sobriety. They're able to sign a lease, and then we'll work on whatever those issues or those barriers are that might have contributed to their housing crisis in the context of a home-like setting, in a housing setting. So there's not preconditions. A lease is not something that they earn, or housing is not something that they deserve after they've demonstrated compliance with some other expectations. It's immediate access to that housing. The supports that are provided in the home need to be flexible. It's not a one size fits all. We develop individualized case management plans based on what the client has indicated in terms of their core interests. As we've talked about in previous trainings, maybe their core interest is getting their kids back if they've been in custody. Maybe they just want to get a job or get a better job. Maybe they want to have a place where they can entertain. They can have their boyfriend or their girlfriend stop by, and that's something that's really important to them. So we use what is a critical, important goal that the individual has to design a service plan that identifies retaining that housing or maintaining compliance with that lease is actually connected to what's important to them and what their goals are in life. When there's really significant barriers to housing, then we have to increase the intensity of the services, and it might require a high acuity team that has additional capacity that's not just about housing and maintaining the terms of the lease, but also addressing some other issues. If there are active mental illness that's untreated, substance use disorder, other kinds of disabilities that are contributing to housing instability, the housing plan has to be able to address them. It's not always the housing case manager. It might be paired with a community-based resource or some other mental health or treatment provider that coordinates with that case manager to provide that more intensive support for people who have higher barriers. And then the third component is the standard tenancy expectations. Just because it's housing first doesn't mean you don't have to pay your rent. So they have to follow the terms of the lease, which means they're paying the rent, they're paying it on time, respecting their neighbors, they're not having parties late at night. And that we know that many of the clients have struggled with these issues, and that might have contributed to their housing loss in the past. So it's not to suggest that those aren't going to be issues, but we use the lease as the way into a service plan, paying rent on time, so managing their finances so that they're able to contribute to their portion of the rent, looking at the lease terms in terms of, is there a quiet time? So quiet hours start after 9 or after 11 or whatever it is. If it's in a neighborhood where there's a lot of foot traffic or activity just on the street right in front, how is the tenant in that unit going to maintain their own security when there might be either potentially even illegal activity, drug activity that's nearby in the neighborhood? So we're using the lease itself to understand expectations around how to maintain that unit. And when the client is engaged in behaviors that might risk their lease agreement. So they're engaged in maybe illegal activity. Maybe there's some drug dealing, or they're having parties. And so they're having guests who, routinely large parties, and people are spending the night. So those are all going to sort of be red flags for the property management or the landlord. And when those kind of things surface, which oftentimes they will, we use that as an opportunity to engage the tenant, the participant, in exploring how to reduce the risk to their housing, maintain compliance with the lease. It is not just an immediate termination, and we work with them while they're addressing whatever barriers or challenges they're having. The goal is housing stability, not necessarily full compliance. We recognize that full compliance with the lease terms is in many cases not going to be achievable, at least not out of the gate. So when these non-compliant issues come up, they're not paying rent on time, they're having wild parties, there's illegal activity. All of these are learning opportunities, and it's an opportunity for us to engage, to titrate up the intensity of the services, to talk with the participant about how these risky behaviors or how these conditions might be threatening their housing. So those are sort of the kind of the core tenets of the housing first approach. As I mentioned before, what housing focused is not is anything goes. And we've seen, and I don't know how many of you have had participants that either you've housed or maybe have come back to shelter who have these kind of behaviors. And it's not every person, but when we do have these people that are in our projects, it really absorbs a lot of our focus and our attention when they're engaged in hoarding, they're engaged in maybe illegal activity, they're not meeting the tenancy requirements. It doesn't mean that we just turn a blind eye to this. As these kind of behaviors surface, it's an opportunity to re-engage and talk to the client about how these behaviors are threatening their housing, or these might be putting their tenancy at risk. The goal is to keep them in housing and keep them stable in the community as long as possible. And we do that by intensifying the supportive services, and when we need to, engaging in the landlord to coordinate maybe a kind of a mitigation plan. We know that hoarding has been an issue for a particular client, and so we're going to talk to the client about what are expectations around maintaining the unit, and we might share with the landlord that we're engaged, we're aware of this, and we have a plan to address it so that they can maintain the housing. We'll talk a little bit more about, because these cases come up not infrequently, we'll talk a little bit more about what this might look like and how to manage this, especially some of the hoarding cases. I want to talk now about staffing and service supports. The adequate staffing to conduct, say, home visits, weekly visits. At a minimum, we want to be doing at least monthly visits, but the ideal is to do frequent home visits, and the ideal ratio of a client base is between 15 to 20 clients per case manager. We know not all projects are able to manage that. Oftentimes I've come across, PSH or rapid rehousing projects where the client to case manager ratio is much, much higher, sometimes 25 or even more. It's not always ideal in a housing first or housing focused setting, but it's not unheard of. So we just have to be aware of how to manage cases. And if you have a lot of clients that you're managing or cases that you're in charge of, we'll want to talk about those caseloads. The caseload should be driven by client acuity, client need, client risk, the housing barriers that the clients have. But I know that funding constraints and program design doesn't always allow a kind of 15 to 20 client per case manager ratio, but that is the sort of ideal in a housing first approach. As we've talked about, clinical support is essential. Case managers and supervisors, if not clinicians, if case managers are having issues, they should go to a clinician or get professional input about working with clients. Use your peers. Many of you have indicated in previous trainings that you've been involved in doing homelessness systems work or case management work for several years, some of you over 6 years. There's a wealth of knowledge and experience, and that's always the first place I would go, is talk to my peers, go to my clinical manager, go to other staff who've been involved with this, and always ask, when I have a challenging case, and we're operating in this housing first approach, and so I know that just because there's risky behavior or there's challenges, and there's maybe lease compliance issues, I know that means that we're not going to just kick them out. So I need some help in kind of managing these cases, and often your peers are a good source of input about how to deal with these cases. In Housing First, the sort of low demand, high expectation model provides what is known as immediate permanent housing without behavioral prerequisites. So that's what we mean by low demand. It's maintaining expectations for housing, but we know that these behavioral issues are going to come up, and not an expectation that they have to be actively and compliantly participating in their mental health treatment plan, or they have to actively be participating in substance use treatment. That these issues, behavioral health issues and other kind of physical health issues, have ebb and flows. And sometimes there's relapse, sometimes there's, 2 steps forward, 3 steps back. We know that that's just part of the natural human experience, and we're expecting that there are going to be missteps. It is not a straightforward path. So this low demand, high expectation approach is just a model that is always putting immediate permanent housing at the forefront, and this expectation that we're still expecting compliance with the lease. We use when we see people who are using, so like, first responders, emergency rooms, or other kind of complex legal issues, health issues, that these are kind of high demand health issues, and we document them, but they're not reasons for evicting someone or getting that. It's someone who has constantly been having the police or first responders come to their unit is not a reason to terminate them from the program. In a housing first approach, we would just re-engage them. There's expectations that they're going to participate, but if they're not actively maintaining the unit or maintaining expectations of the lease, it's just an opportunity to re-engage and try something new. Some of the biggest criticisms about the housing first approach in this kind of staffing model is that it's this low demand, high expectation approach is that we're allowing anything in these units, and that is not the case. And some of the evidence that we've seen in housing first approaches, there's lots of programs that operate in fidelity to housing first, and in evidence across the country and studies that have been done, I think the rate is around 88% of participants in housing first projects when they are operating in fidelity to housing first. 88% of participants are able to maintain housing after 5 years. So we know that it's a cost-effective approach. We know that it reduces inappropriate use of emergency rooms, first responders, and other kind of emergency calls. So there's lots of evidence that it is an approach that works. It is not one that's easy to implement, and so that's why we're walking through these elements in this training today. All right. Let's talk about tenancy and harm reduction.
Excellent. Thank you, Matt. So when we talk about tenancy, we're talking about the rights, responsibilities, and skills involved in getting and keeping people housed. Many of you know about harm reduction, but harm reduction is an approach that focuses on reducing the negative impacts of a behavior while respecting people's choices, supporting health, safety, and goals. When we talk about harm reduction with our folks and in housing settings, we mean meeting people where they are without judgment. We mean building trust and relationships, supporting practical steps that are always reducing risk, and recognizing that change happens over time and looks different for each person. So Matt talked about this too. It is not a one size fits all. It's really recognizing that everyone has their own journey. And when we talk about housing first and housing focused approach, it really works naturally with harm reduction. And so we're going to talk about that in the upcoming slides. I'm really interested, though, in hearing, like Matt said, about your experiences. And so please jump in as we go through these slides. Okay. So Matt just mentioned this, low barrier, high expectation. So I'm going to repeat it because I think it's important. So low barrier doesn't mean anything goes. It doesn't mean anything's accepted. What it means is that there aren't sobriety requirements. You don't need to have treatment before you can come in. We're not proving that you're ready. And you'll hear, I remember back in the day, I'm old enough to say back in the day, we used to talk about housing readiness, right? So I remember there used to be like a chart people would fill out. Are they housing ready? And had all kinds of compliance issues. That's not what housing first is about. That's not what a low barrier approach is about. Low barrier approach is making sure that we make housing accessible to everyone, that everyone deserves housing. That folks have, like Matt was talking about, the same rights and responsibility as any renter. You all may have been renters. I was a renter. I had a lease. There were things I need to follow. Just because folks may be in PSH, no different. They have a lease and they're expected to follow it. And I think what's really important, I'll do a plug. I always do a plug. People can't follow a lease if they don't have a physical lease. it's really, really important that case managers meet with folks after they've signed their lease and go through it again. Also, I don't know if you guys have read a lease. I mean, I'm not an attorney. Leases are hard to read, right? This party and this party. So we want to help break it down for folks. And if you don't understand something, sometimes you can get a plain language lease, which kind of mirrors whatever lease they have. Obviously, you want to make sure the specifics are there. Matt talked about quiet hours, all of that. And then people need to have a copy of their lease handy. And one helpful, I think, intervention is when there's a lease compliance issue, you can sit down and talk to the tenant about it. So it's not about, oh, my landlord's being unfair and this is happening. You can say, hey, let's sit down and look at the lease that everybody is supposed to be following who lives in this building, and let's see what they're talking about. And maybe they're wrong, or maybe you're going to let your client know, in fact, it does say this in the lease. What are your thoughts about that? What could we be doing together? So there's a lot of work for case management. Participants are going to, we talked about this, assume full tenancy rights. So just like any other renter would. So when we talk about high expectations, we're going to engage, right? So we've talked about this in all our previous trainings. We're going to look for comfort because we can't engage folks unless people feel comfortable and safe. So I think we gave the example of if someone has a really sore infected foot, they probably don't want to sit and read the lease with you, right? And they don't really want to talk about their housing goals. So we're always going to provide comfort to folks. We're always going to look at folks' strengths. And sometimes you're working with a really hard to engage tenant, someone who's really just making your life a little bit difficult. So maybe the success is, hey, Bob, thanks for showing up today. What a success, right? So part of our engagement is always celebrating even small successes. And we're going to work on goals. I won't go through it again, but remember we've talked about that. So I want to live in this building. So that what, Bob? So that my kids can stay with me, so I can have a date, so I can have a place to put a big screen TV and watch football. So we're always going to keep goals relevant, like Matt said, client focused, and the clients are driving the work. We are going to always give really good options and have folks explore all the different things. So people we've talked about this, they may want housing that's not reachable yet, but we're going to work towards small goals to get them to where they want to go. We're going to have evaluative conversations, which is lots of questions, collaborative interactions. What would work best for you? You might be dying to give the answer. You know the answer, but we want the client's answer, right? So what's going to work best for them? Matt talked a little bit about different roles. So we have roles of providers, we have participant roles, and then remember we have property manager roles. So you as a provider, you're an advocate, you provide support, you provide connections, you have lots and lots of jobs. Participant roles are to be the best tenant they can be, and you're going to help them with that. And just to throw in, you aren't the landlord. So you're not going to help evict them. You're not going to talk to the landlord about anything you're not supposed to. And you're going to be an advocate to do everything you can to keep your clients to obtain and maintain housing. You're going to assess and establish goals for housing access and retention. So I just talked a little bit about that. We're going to see what inspires folks, what motivates folks to stay in housing, to access it first, and then to stay in housing, and then to work on those attainable goals so that folks can be successful. I'll stop for a minute and just ask, is this making sense to folks? Does anyone have comments, questions?
Hey, Liz, a question came up in the chat, and I'll give it a shot, but I'm curious if you have thoughts about this too. As we're talking about housing first, and often, we're preaching to the choir. There are lots of staff on this call who get it, who understand, housing is a foundational element, and we need to build a whole kind of case plan around housing first. But a housing first or a housing focused philosophy or approach for your system in and of itself does not create new units. It doesn't come with, sort of ready-made apartments that are fully funded and ready to lease up with your most challenging cases.
Right.
It's sort of the same frustration that I had with coordinated entry back in the day when we first started designing and implementing coordinated entry. Coordinated entry didn't create more housing. It didn't create new units. It didn't establish like a whole new resource that didn't exist before. So I get it that it's so frustrating because we're sort of, like kind of singing the praises of Housing First and definitely encouraging all staff to deploy these Housing First principles. But yet, at the end of the day, you're still in an environment where you're resource constraints and there aren't housing units that are readily available for every single person. And so I get that it's frustrating and that even though we're talking about housing first, it doesn't actually translate to, ready-made housing for every single person who's coming into the system. And I don't know, Liz, if you have thoughts about that as
Great.
well.
Yeah, I'm happy to, but I see Derek's hand, so I'll let Derek talk and then
Oh,
I'll share
great.
my
Yeah,
thoughts.
jump in,
So,
Derek.
I mean, I don't want to get us like too derailed on this because I think it's important, like for those clients that we can help, that we get guidance on how to do that well. But I think as someone who doesn't directly work in permanent supportive housing, I can say that I have never successfully referred a client to permanent supportive housing. I have only rarely successfully referred a client to rapid rehousing programs just because those are so unavailable. And so it's not even just that like we can't help like every single person. In my experience and in the experience of a lot of the caseworkers that I work with, it's not that we can't do that with everyone. It's that that's right, not the norm. That's not the norm, right? The norm is what do we do when the resources are not available? And so the
Yeah.
idea of immediate access to housing, the idea of choice of unit and location, that just sounds like a fantasy for most of the clients that
Hmm.
I'm working with. And yeah, the idea that everyone deserves housing, I definitely agree with, but I don't like know anything to do with that commitment other than, again, you try your best with every client that you get, and we do have some successes, but yeah, just I mean, just acknowledging that that's not the norm, I think, for many of us working in this
Absolutely. And
sector.
I think that's really important. And that also is part of being really honest with whoever you're working with, which is, and I think we talked about this last time with Andrea also, that yeah, we have these resources. You may wait a year to get them, and then you may not get them at all. So, what can we do in the short term? And I see Samuel's hand, but let me just say some strategies I've seen, and I don't mean to sound Pollyanna because it is hard to find immediate housing. It's hard to find a room, but we're really trying to work. I know nationally it's been a big push. We're doing work here in Connecticut on shared housing. So really setting expectations that this is not your forever home. Is not your dream home, but you know what it is? It's a couch, it's a bed. We can figure out how to get you there. The other thing is working as closely as possible with landlords, which I know is not easy. Sometimes there are landlords incentives. Not every state or program has that. And the other is educating landlords that I'm not just helping Bob get this unit and then saying goodbye. I'm here for Bob. And you know what, too, landlord, you can call me if Bob's screaming in the middle of the night, or let's come up with a plan together. Again, I know some of that sounds pie in the sky, but it does work in some cases with the right landlords. And I see Samuel's hand.
I second what you just said, ma'am. That's Liz. That's exactly what I was gonna hit. I think it's more education towards the landlords for the people that we're trying to serve. I agree with Derek also. That is tough for to find housing for numerous people. Just on a personal note, I've been through it myself. I've never been evicted. I've never been put in a position where I couldn't get housing, but I've been stigmatized against in the sense of once they see me, I can talk to them and I can have a conversation with them. And then once I get to the place to rent the place, I've been turned down. So I lasted homeless for almost 4.5 years. I lived in my car and I lived on couches and unfortunately it's unfortunate, but I made it through. I'm one of probably a few that can really say something like that. But I think that re-educating landlords, like you said, Miss Liz, letting them understand that if Bob is screaming at night, call me and let me know what Bob's doing, because I'm here for Bob more than I'm here for you. I'm not renting the apartment. I'm trying to get Bob into the apartment to make sure that they can keep a roof over their head in some kind of capacity. So I think that if we educate the landlords more and just be honest with them and talk to them and not at them, and let them understand that this is a process. This is not Rome wasn't built in a day, and so we're not going to build a whole crazy living situation, but we're going to try to make sure it works for this client, this particular client. and we can go from there. But I really, really, really believe in educating the landlords, because I have a lot of friends that are landlords and they are uneducated in the aspect of homelessness and people not being able to pay their bills. They think, oh, if I rent it to them, they should be able to pay their bill. Well, yeah, I agree with you, but obviously we're living in a tough time and we live in America. So things are not always what they seem to be.
Yep. Thank you, Samuel. Really helpful. I
Yes, ma'am.
appreciate your insights. Does anybody else have questions? Cypress?
I find another problem, or at least like with the landlords that I work with, is a lot of landlords like that their tenants are rotating, or they like this rotating door of tenants. And it's to them, it's more about getting a check from the state or getting a check from an organization like my organization does, rental assistance, more than maintaining a tenant and that tenant's well-being. And I mean, I work with some lovely landlords, but for the most part, I work with a lot of landlords that are just really focused on when's my check coming and who can I get in the door so I can get a check out of them. And I think that is also a barrier that makes this work hard.
I agree. That does make it hard. It is not.
I forgot to add that Rick was 100% correct. That's crazy. I love this conversation because it's so true. It's a lot of landlords that I know, all they want is the check. They want to know when that check's going to hit. When is it coming? It's not here yet. I've been waiting 2 weeks. I've been waiting a day. I've been waiting a minute. When is that check coming? And they love to have different tenants. They absolutely, he is 100% correct. Oh, my Lord. Thank you for having me in this conversation.
Thank you, Samuel. Thanks for joining it. All right. Well, because as Matt said, we're preaching to the choir, and we know that I'm going to go quickly through tenant rights and responsibilities, but I will start at tenant rights. And like Matt said, you're practicing this, you're doing this, but I think it's just important to talk about how important tenants' rights are. Again, no different than others. We keep saying the same thing, but it's really important. Same as general renters. But I think what's really important is, you guys know this, a lot of the folks you're going to work with, maybe this is their first lease, or maybe it's not their first lease, but we're going to hope it's their first really successful lease. And we've talked in the other trainings about folks who have been really traumatized and really failed by systems. And so we really want them to feel empowered as tenants. We want them to know that the rights they have, we'll talk about them in a second, but we want them to know that they deserve this housing, that they're worthy of having this housing. So I think that's just worth mentioning. And that, folks deserve to live in decent, safe, sanitary housing. There shouldn't be mold, broken heat, rodents, leaking roof, and that the landlord is responsible for fixing it. And again, while that may seem intuitive to us, it might not seem intuitive to somebody, again, who it's their first lease, or it's their first really good lease, really good place to live, and they might not want to cause problems. And they may think, oof, well, last week I was sleeping in a tent. So this week, if I'm in an apartment and it's a little cold, I can live with that. So we really want to empower and make sure that our tenants, our clients, know that they deserve this housing and that all repairs should be done in a timely manner. And you all know this. You may have to be part of the nexus with the property manager or the landlord, and that's okay, right? We eventually want folks to know to put their own repair orders in, work orders in, but at the beginning, you may have to sit down and help them do that. We want to always let them know that it's their house and that people need to give them notice, unless it's an emergency, if there's a fire or something crazy going on, that there should be notice. And we should also honor that. So we don't want to just knock on the door without an appointment, right? We want to model good behavior. We want them to know that this is where they live. And so we want that both for the landlord and for any services that are being provided there. And if the landlord isn't maintaining the unit, you may be able to have them withhold their payments. I always say this cautiously because you probably want to consult an attorney before you're not paying someone or not telling someone to pay their rent, but that may be an option. And just the practical tip that you want to go through all of these rights early again. You've sat down with the lease and you've told them all the rules, but then you also want to tell them about all their rights and what they're allowed to do as a tenant, and so that they know that. All right, let's move on from rights to our flip side, right? Which matters just as much, tenant responsibilities. And that our job is to make sure, like I said, that folks know that It's our job to help them with the lease, to help them be compliant with the lease. But that Matt talked about this earlier, that when a client is struggling, it's a signal and it's time for us to engage. So it's not for us to judge. It's not for us to ignore and just hope that goes away, but to engage and say, what's going on here? And how can I help? What can I do to help the situation? So I've talked so much about the lease. We're going to follow the lease. We're going to meet with them. Samuel told us that we got to pay the rent on time. We're in a lot of trouble, right? So it's interesting because not all landlords will send out an invoice. You want to encourage all the landlords you work with to remind folks that they need to pay their rent, right? I'm not going to remember to pay my phone bill, other things, until I get something that tells me I need to pay it. If that can't happen, you might just want to set up a system with folks and a plan. When are you paid? When do benefits come in? When is rent due? And sit down. And again, I would say, remember that this isn't going to be intuitive for all the folks we've worked with. And again, I'll reiterate, maybe it's the first time they've had their own apartment, or this is going to be the first time they have what hopefully is a really successful time in the apartment. We only want authorized tenants to sleep in the units. So that means long-term. So again, folks have apartments. They're allowed to have guests. I have people sleep over. Nobody should have to have permission to have a guest sleep over. But we always want to be careful about the person who moves in, because we don't want to risk tenancy. And so we might need to work with the tenant about cousin Denise, just moved here from California and she's sleeping on a couch and has no place else to go, that we problem solve where cousin Denise can go so that we don't risk our tenancy there. We're going to respect neighbors and talk about other people's peaceful enjoyment. Mentioned it. We want to know when those hours are. We want to nip it. You might your tenant client might be just having fun outside and talking too loud, and the landlord's really mad. So we want to talk to the tenant about what could be done. Doesn't mean you can't be loud. Doesn't mean you can't have fun. Can you do that maybe inside or somewhere else? We always need, this is everyone's favorite, information for annual recertification. This is non-negotiable. You need this information or you can't stay in the unit. So you want to give folks warning, when is this coming, and sit down and make this happen. And you want to report any changes that your funders require along the way. Again, these are game changers because these are required, and folks can be evicted for not providing the accurate information to folks. We just talked about required inspections and people coming to your unit. So we just want to make sure folks know ahead of time. Matt mentioned hoarding, which can be a real problem for some folks. So if you have an inspection coming up, we might educate our tenants and make sure they know, these are the rules, and this is the kind of space you need. And there are often you can really find out how much you can keep in an apartment safely. So you want to work with folks ahead of time. And just like rent, you have to have your utilities current and paid, because unfortunately it doesn't feel good to have no lights and be cold, but you can also be evicted for not having any utilities. So we always want to watch that. I'll pause here for a second. Does anyone have comments, questions? No, I'm going to keep looking at our time. I'm going to keep moving. All right, so we're going to go to harm reduction principles. So just like housing first doesn't mean anything goes, harm reduction doesn't say I condone and encourage drug use. That is not what harm reduction is. What harm reduction is it accepts an individual's decision to use substances as a fact without moral judgment and address the consequences while helping folks reduce risk. And any positive change in this, we always, again, want to celebrate. We want to also acknowledge that folks who have come, so we talked about this a little bit with Housing First, but if folks have come from an abstinent-based program, this can be really different. So we get that, and you may want to just acknowledge the discomfort about it. But harm reduction doesn't ask you to stop caring. It just asks you to care in a different way. So this came about, the roots are in the HIV/AIDS work. You guys might know this in the 80s with needle exchange, which was very controversial. But data showed that with needle exchange, there were fewer overdoses, fewer infections, and that more people were living long enough to seek treatment eventually, if that's what they wanted. So if we apply this to housing, if a client's using in their unit, our immediate goal is not sobriety. It's to keep them housed and to keep them engaged. And we already talked about how harm reduction is not anything goes, just like housing first is not anything goes. It sets clear limits, and especially in non-negotiable situations, which we're going to talk about. So as we talk about harm reduction principles, it makes sense that it supports tenancy because they share so many of the same aspects. We talk about accessibilities, we talked about low barriers, non-coercive ways, and we always find choices for folks. Participants identify their own goals and the paths to achieve them. Clients always drive the work, and we find their own reasons for change, and that motivation can't be forced. Staff raises awareness of risk and strategies to reduce harm, and we're going to go through some examples in a few slides. And while abstinence may be a goal, we're always going to talk about alternatives that reduce risk and that those are equally valued. And that Matt talked about this. Recovery is nonlinear, and so we're going to be patient and realize the ebbs and flow of the human condition and of recovery. All right, should we keep going? All right, we're going to talk about some examples, and this is where I'm going to be pushy and make you jump in after I talk for a minute to see if you have some examples here. So harm reduction isn't just a philosophy, right? It's practical. It applies across lots of different kinds of behaviors, not just substance use. It's not applied, and another slide, we'll talk about non-negotiable situations. So in time, and we'll talk about more examples, but in those cases, workers have to be assertive, and we're never talking about putting people at harm. So we'll talk about that after. Like we talked about this is based on public health goals. So we're always going to be asking what reduces harm and what keeps this person healthier and more stable. When we talk to substance use, like I was saying, it's not all or nothing. Does your client want to move from hard liquor to beer? Does your client want to limit the hours that they drink? But it's not abstinence as the main goal. And that may be your tenant's main goal, and you're going to work towards it, but you always find solutions in between, and we're always listening to what tenants want. Medication compliance. So there's a scenario where you have someone who is hearing voices and responding to voices, and they are not sleeping. And you've asked them if they have any interest or if they're taking any meds, and they say absolutely not. So a harm reduction approach might be, can you figure out how to take sleep meds so you can sleep at night? Finding different ways to honor the folks not wanting to take meds at that time, but at the same time, trying to address the behaviors which don't feel good to them. Behavior that risks tenancy. We're going to work on what's changeable. I just talked about a tenant who's outside being really loud with their friends and really upsetting their landlord. Can they move inside? I'm going to give a couple practical examples, and then I would love some of yours. So sometimes folks do better in the early AM, maybe people who are living with depression or PTSD. It might be the opposite. They may do better with benefits, to go to a benefits appointment and see a DSS worker at 2 p.m. instead of 8 a.m. But that is all harm reduction. So we want to make sure people aren't missing their appointments, and we want to be really flexible about how they can still get those services. I just talked about the sleep medication. Same things about employment. So if Bob can't get up at 8 a.m. for work, are there other shifts available for Bob to work? Is there a different job? But we don't want to throw our hands up and just say, gosh, Bob just can't work. He just can't make it happen. So we want to be really flexible and figure out how we can help out. You want to go to an AA meeting, even when you're still using, what does AA say? Keep coming back. And you want to let folks know that. And in terms of rent payments, maybe it's a direct vendor check payment. I talked about this earlier. Maybe you find different ways for rent to be paid, but you sit down with folks and make a plan so that people can be successful in housing. And I'm going to stop for a second because I want to see if anyone can give some examples in their work about harm reduction, whether it's with substances or other behaviors. You know you have one. Anyone? Where's Samuel? Samuel, you like to talk. Come on, Samuel, where are you?
I was trying to conjure up a few. I have a lot of examples.
Great, just one. Something where it made sense to be flexible and use a harm reduction approach to reduce risk or promote success in some way?
Well, my job, we really promote harm reduction. You really can't stop people from living their lives in some kind of capacity and the way they do things. And so we just try to make sure that we have everything available for them to proceed with their harm reduction, to make sure that we're not supporting you to use the drugs, but we're just supporting you to use it in a safe way so you can live longer and you can try to be here longer, not sharing, and just try to slow down the prevention of disease and things of that nature. So we just try our best at my job to maintain a good harm reduction barrier. We have the Narcan and as the clients like to call them, the pens. And we have several other things that help them with their harm reduction. So we just really, to be honest with you, we just really support real harm reduction. And we just try to teach our clients to do what they have to do. We have clients, high-risk clients, clients that have been using practically their whole lives. And so, it's sometimes it's very tough to try to tell them not to do what they do. But like I said, what we can try to do on our side is mainly support them in the sense of doing it safe. This is the safest way you can do it, safest way you can prevent getting a disease or getting harmed in some kind of capacity.
Oh, thank you, Samuel. That's exactly it. You said it exactly right. Providing the support to limit the risk. So thank you for that. And I'm watching our time, so I guess I will keep us moving in supporting choice. And we're going to talk about the 3 zones. So the comfort zone, this feels good. That's why it's called the comfort zone. The client makes a choice we are comfortable with. We're going to support and assist them. So maybe a client decide to attend a job readiness program, and we will help support them, ask questions, what we can do in terms of transportation or resources they may need to get there. Wouldn't it be great if we lived in the comfort zone forever? No, we're going to move on to the conflicted zone, right? And this is hard, right? This is where clients make a choice and you feel conflicted. And this is where we're going to use harm reduction. We're going to explore the risks, and we are going to continue to support the person. And this is probably where you live most of your day in clinical work. Someone's making a choice that really, really concerns you, but maybe there's no immediate danger, because we'll go into that in the next zone. But again, this is our harm reduction zone. So your job here is not to shut it down, right? Not to issue ultimatums. It's to stay in the conversation. And we're going to explore, I've noticed you've been using more lately. Can we talk about what's going on? What feels risky to you? Right? Easier said than done. Maybe someone's drinking more than usual. You're worried about both their safety and their tenancy. And so we can't say, or we're not going to say, you need to stop drinking or you're going to lose your housing. We're going to say, I've noticed things have been harder lately. What's going on, right? So the conflicted zone, what does that make us do? It makes us engage. I'm sorry, I have to move. I'm losing my notes. So then we move into the non-negotiable zone. So this is when a client makes a choice, poses significant immediate or imminent danger, and we have to act immediately and assertively. So this is not a zone for asking how you can help or how do you feel about this. If someone can get hurt, the participant, a neighbor, or your tenancy is immediately in jeopardy. So maybe a participant is threatening a neighbor, or there's a fire hazard in the unit, or someone's in a medical crisis. We have to move quickly and clearly. You can contact your supervisor. We're going to involve the landlord if necessary, call emergency services, and we're going to document everything. And again, remember, this is not an area just where you're not quite sure and you feel discomfort. This is where there's imminent danger. Okay. Does anyone want to jump in? Does anybody have a conflicted zone or a non-negotiable zone example? Or if you're not sure where it fits?
Liz, I'll just say that I know in the teams that I've been engaged with, actually describing the case management relationship to the participant in terms of these zones. Like, I hope that we can achieve the comfort zone all the time. Sometimes it's going to be conflicted, and sometimes there are these non-negotiables. And being clear before the issue comes up that there are instances where the case manager either has a mandate to report something, or they're going to, because there's an immediate health or safety risk, they're going to step in so that it doesn't feel arbitrary later. So
Yep.
introducing these concepts maybe early on in the case manager client relationship and in the work that I've done has been really helpful because it gives you a little bit of kind of clearance to then sort of call this out when it's apparent.
Exactly. Oh, I love that. Agree. All right, so let's talk about a harm reduction plan sample. So maybe you guys have even experienced something like that. So unfortunately now eviction is being threatened because the landlord smells marijuana coming from the apartment and then there are children in the building. So what are we going to do? We put 3 options here, but there are many other options. So maybe stop smoking pot altogether. That would solve the problem with the landlord. It would save money because marijuana is expensive. And maybe the tenant could even get better employment. But we don't think our tenant necessarily is on board with this. So if you don't have a real commitment to this, they're probably going to have relapse. And the reason the tenant is smoking marijuana is because the person has PTSD. The non-negotiable is we have to address the behavior, right? So that one's not negotiable. Maybe our other options are to find another way to consume. Maybe this would address the landlord concern and then it would allow for continued use, but there's an expense and there may be legal and employability risk. And the tenant just does have to pay rent, right? In our non-negotiable. Other options, we're going to find a substitute. We're going to try to, we know that would resolve the nuisance, but now we're going to put the person at risk for prescription meds, and it could increase risks. So as we go through this example, it's not a sample. It is not easy. And there could be 10 other ways to address this. But I think what's important, and Matt just said, talking about stuff ahead of time, I think you can put this on paper. We've talked about this before. Put it right down in front of someone and go through it. And we're not telling the tenant what to do. And we're engaging the tenant all along the way and asking them about the options and what's going to work with that option and what's not going to work in that option. And then what do we have to do? And I think it's really helpful to see a plan like this right in front of someone. And again, you can go through it with them. And there aren't easy answers. It doesn't mean this isn't a panacea to the problem, but it gets you there and it gets you talking. I'll stop there. Questions, comments? Looking at our timer. Matt's going to, I know, quickly go through some case studies.
All right. So the case studies, I think, are really helpful because it gives us an opportunity in a practical sort of real life setting, explore some of these concepts that we've talked about around housing first and harm reduction. It's always easy on paper when Liz and I are just talking about, the evidence-based practices, the essential elements, exactly how to do this. But when it plays out in real life, it's always so much more nuanced and complicated. So that's why these case studies are important. I'm going to go ahead and read the first one, and then hopefully you all have thoughts and you can jump in. I really welcome your contributions as we kind of think through what to do. So I'll just read this. The first one is Josh. Josh is 24. He left home when he was 12 and entered foster care, and then he got into the military. When he got out of the Marines just a year ago, he was couch surfing, he spent some time in shelter, and he's been on the street. So for a year now, he's been homeless. He does work at day labor, but he smokes to what he says to help stay even. And he does go to the VA sometimes because he's part of a PTSD support group. He just says he wants a job and a normal life, not one that's filled with a bunch of social workers. You find out from a friend that he currently bought a car. That's interesting how he somehow managed to buy a car. And he has a sister, but he hasn't been in touch with her and he'd like to reconnect. So in this approach, there are some housing focused or housing first principles that we're going to apply. So again, Josh has been homeless for a year. We know that there's he's smoking weed. So there's some active drug use. It looks like he's got some ability to work, although it's day labor. So that might be inconsistent. And we're not sure of what the employment's history or income is. And we know that he's actively engaged at the VA with a PTSD support group, but doesn't seem like he likes case managers, doesn't like clinicians, doesn't like people poking around his business. So as you're a caseworker and you realize now that he has just bought a car, what is emerging to you as sort of really helpful information if in a housing first approach, we're going to really support his interest in stabilizing, just get a job and get a normal life. And housing could be a foundational element of that. And also applying some of the harm reduction elements that Liz discussed. Any thoughts? Any of you have, what would be sort of your initial thinking around what's a housing first harm reduction plan for Josh? Anyone?
I would say looking into alternative veterans resources,
Great.
kind of like Operation Stand Down, getting him connected with people there that could maybe help him find housing.
Great. I love that idea. Like the VA is like a big sort of like bell in my head. Like, okay, there are plenty of resources in the VA system and we want to leverage those. So while navigating housing in the private market might be really challenging for most people, but if there are resources that we can leverage from the VA, that's just going to make that a little bit easier. So I love that idea. Let's leverage those VA benefits and see if there are VA programs.
We also have something in the chat, Mac. What's your name? Reconnecting with his sister, right? We know that's important. So we want to explore that and maybe help provide resources or support to make that happen.
And that's a great idea. And that was one of the first thoughts I had is if he's willing to reconnect, is that a healthy relationship? And maybe there's at least on an interim basis, some shared housing there where he can stay with his sister. If she knows that he is connected to the VA, he's got a caseworker, they're working on a housing plan. So it's not a permanent solution, but it does allow them to reconnect and it gives him a safe, stable place to live while you're working on a long-term housing plan. So that I would explore the whole sister connection.
I wonder, Matt, on the marijuana end, if we want to just ask him what it does for him. So he mentioned it evens him out, I think, and maybe talk about what are the benefits and drawbacks. Just have a conversation about that. Again, not in a judgmental way or not, but does it affect his work, relationships, finances, or ability to get housing?
Perfect. Yeah. Does Josh seem like a typical, like a common case that you might see? Do these attributes, this history are there elements here that resonate as something that you would typically see in either clients that you're seeing it through outreach or in your shelter or in your housing plans? Rebecca says yes.
Yeah. All right.
Anything here that seems like, oh boy, if Josh were on my caseload, I would be really kind of stymied by it. Something that like I've run into this before and I just don't know what to do. Elements here that feel gray to you or, something that's either resonates or similar to other cases that you've had where you aren't sure what the right approach is or what resource to leverage.
I would say for that he smokes marijuana to stay even. I think sometimes it's hard because we want to refer them to mental health resources or other resources, but they're not necessarily open. So then we can talk to them to encourage them, but they don't necessarily want the help, but they may need the help.
Right.
Yeah. And it's also a consideration if he's a regular marijuana user and he's using that to stay even, and we know that he's in a PTSD support group, there's what that says to me is there might be some element of self-medication. And if that's working for him and it's allowing him to stay even, he's, is able to do day labor and manage kind of like other daily activities. It might be that that's a useful strategy in the short term. But again, there's some questions around, are there other treatment elements, whether that's talk therapy or the support group at the VA or other kinds of medical treatments that are going to help with either the depression, the PTSD, that are going to have similar kind of benefits of that staying even that might be able to replace the marijuana. I don't know that that's, like a deal breaker that he would have to get off that or do something different in order to prove that he's worthy of housing or, get a different job that's not going to be doing drug testing. It may be if that works for him, we just have to explore that. If that's a useful strategy and it's not, as Liz said, it's not sort of inhibiting other aspects of his life, he's able to manage, at least a harm reduction approach might say, let's, as long as he's, functioning and it's not negatively inhibiting other aspects of life, we'll keep him going.
Hi, Matt. I had an idea for the employment. Could he, so like Crossroads has a job education employment center or department, maybe discussing with the client, would he be open to something like that for the work? Like start, because our employment department like helps get career ready, does resumes, helps them get jobs, go to job fairs, that sort of thing. Is that something that the client would be looking for?
Yeah.
And then the other aspect is I see this on a regular basis that clients don't want to work with multiple caseworkers due to like past trauma or history, and always changing it to like helping them focus on the ways that they can like self advocacy in a way, and just say like this doesn't have to be a permanent, like this is just helping you to not get better, but to like strengthen your self advocacy skills.
Yeah. It's interesting that you brought up something, and I hadn't considered this, but I would want to know, is there like a release or a consent that he signed with the VA that would allow the caseworker to coordinate with the VA? Maybe he really trusts his VA worker and not you, or vice versa. That release of information, or that kind of shared partnership with another system, might be able to concentrate or minimize the number of workers he has in his life. And so that might be a great idea. The other thing is, on the plus side, he is showing or demonstrating a willingness and ability to work and day labor. But on the sort of downside is that that's really inconsistent. And maybe there's other employment opportunities. So looking through kind of a workforce development or other kind of employment programs, there's already demonstrated willingness and ability to work. And so we might want to leverage that through something that maybe is a little bit more stable, or developing concrete skills that can be leveraged in another setting. So those are both great ideas. Yeah. Derek, please jump in.
Yeah. So, I mean, a couple of things that I notice. I mean, one is if he's only been out of the Marines a year and he's been couch surfing part of that time, he's not going to be eligible for permanent supportive housing because he's not going to have the 1 year of documented homelessness. If he's currently couch surfing, at least in Rhode Island, he's not going to be considered for rapid rehousing just because by prioritization wise, category 1 clients are going to be prioritized for that. And certainly for my program, which is aimed at, and some programs won't even be able to help him if he's couch surfing because he won't be literally homeless. My program, which is aimed at homelessness prevention, could, but he's going to have to get that income and a job and find an apartment that he can afford. We could certainly help him apply for, subsidized housing, but we all know those waiting lists are long and they're not going to solve his problem in the short term. So I think we would have to try to work with him on getting some steady income before we would be able to help him with our program.
Yeah, great points. I think absolutely right. The sort of inconsistent homeless history creates some challenges around eligibility for PSH and rapid rehousing. With the VA, though, there are some potential opportunities with the SSVF, or Supportive Services for Veteran Families. He would qualify for some either rapid resolution or other kinds of programs. So using that VA connection is really going to be important to explore, because unlike other programs, there may be some added flexibility or options that you can pursue. But those are right on. Absolutely. Thanks, Derek. All right, let's go to one more case, maybe a little more challenging in sort of different ways. And again, I'll go ahead and read this and then we can just jump in. Now let's focus on Claire. From the age of 16, Claire has been in a relationship with Stephen, who's an older, controlling man who has been periodically abusive. They had a child together whom she lost custody of 3 years ago, and their lives have become more chaotic. Substance abuse and homelessness became prevalent. Claire was often in shelter, but she remained in the relationship with Stephen. She struggled to engage with services and has lived this way for about 10 years. So there's a long history of this instability. She stated she wanted a chance to prove herself. So there's lots of little kind of issues here that probably require a much more comprehensive drill down to really understand what's going on. But what we do know is that there's at least 10 years of instability. There's some indications of potential domestic violence, that there's a custody issue, that she does have a child, and that she is expressing a wanting or a willingness to prove herself. We're not quite sure exactly what that means, but we'll want to explore that. So as we talk about housing first principles and harm reduction principles, this is also an opportunity to talk about some of those things that we mentioned before, the different zones, the comfort zone, the conflicted zone, and the non-negotiable zone. And I'm curious if any of the elements in this kind of description, limited as it is, trigger something for you that might be closer to conflicted or maybe even non-negotiable. We'll definitely have to explore this in our housing first and harm reduction principles. I'm interested what you guys have, what thoughts you have. Please jump in.
What does anybody think about the controlling Stephen? Does anyone want to dig into that? Or
My concern would be that she might go back, even though she's already been back and forth periodically and he was abusive. So my concern would be that she'd become stable and then get back into the relationship and fall into the cycle again.
Yeah.
I'd worry about that too. Yeah.
Absolutely. And we know that that's unfortunately, it's a very standard experience in the domestic violence world, where the abuser is both a safety and a health risk, but also an odd form of stability and so the negotiating that conflict is really challenging. And the expectation that very often it takes multiple attempts at leaving before someone finally ends that cycle. So I think that's spot on, Jayla. That's exactly a concern that I would have as well. I'm curious if anyone thinks that where that rises to the level of, when we're talking about these zones, something that's conflicted or potentially non-negotiable, and I am not a victim service provider, so I don't have that expertise, but how we navigate a domestic violence situation or a family violence situation when there might be elements of risk or health and harm on the part of Claire that we have to either manage, report, negotiate, and how that enters into our working with her. I don't know if others of you have experience in that area. Well, it's a complex case. Oh, I'm sorry. Go ahead.
It's a little bit vague because in terms of like her wanting to prove herself, we need to know like in what way she wants to prove herself.
Exactly.
Maybe just continuing that engagement with her so that you provide the foundation for her to prove herself in whatever way she may want to do that. And that's, I guess, engagement would require like trying to minimize risk, identifying like pros and cons of staying in the relationship, what's done, but obviously like easing your way into that, the more you gain rapport with the client.
Yeah. These are really helpful. And I know that this, for me, in my experience, this is oftentimes the most helpful part of a training like this, is to talk about these real cases. And we'll get even more conflicted and nuanced and challenging cases to come up in the future. But I know we're bumping up against the end of our time. So I'm going to ask Liz to kind of jump in and kind of bring us home really quickly. But again, we'll have an opportunity to touch on these. We've talked about the service plan for each. So just kind of walking us through to the end, Liz.
Yes, I will do that. Thanks, Matt. So developing relationships with your resources. So I'm sure you all have a wealth of resources. And Matt mentioned this too, like you guys are such great resources for one another. So to the degree that you can share with one another, this is a great place for folks to go, hey, these people aren't super great, not great with our folks, maybe stay away. But make sure whatever you're doing, you're sharing with one another. And just that you really, to the degree that you can have the most intimate knowledge with where you're sending folks in a resource is really important, because the more that you're familiar with what is actually available and what folks' experience is, the much better you can match it to your participants. So you can always do lots of Googling, but really, let's be honest, we know this, word of mouth is the best thing. Hey, Matt, you went to that food pantry. How'd that go, right? Hey, Derek, you went and visited that new primary care. How'd that go? And you just want to collect as many resources as you can. And again, where I was talking about modeling behavior, you want your tenants to do the same, but we're bringing them along. So we're going to be sharing all the resources that you have. As long as you have permission from your tenant or your client, you're going to go with your tenant or client as appropriate to DSS, to the doctor's appointment, to the food pantry. Introduce yourself to that resource. Tell them, again, you're always going to have permission from your client, but hey, I'm working with Bob, and if it's okay, I'm going to come here with Bob a couple times and check in and see how things are going. So you're going to explain your role and what to expect. And Matt was talking about this, as long, again, as you have an ROI, as long as you have permission. Hey, maybe I'll call the VA, because maybe they'd rather work with Sal at the VA than me. And as we know in this work, you can't have a lot of ego, right? So whoever can do the best work, so send it over to Sal at the VA to do their work. So lots of good collateral contacts with folks and with resources. Also, you want to follow up. So remember, a referral isn't just, hey, good luck, go see that. It's asking your client, hey, how did that go? Oh, that was terrible. Let's find another place you can go. So we're going to always follow up regularly, and we're going to keep promises. So Matt didn't like that food pantry. So you know what, Matt, that was the one I really knew about. Let's connect up. I'm going to text tomorrow. I'm going to text you, or we'll connect up, and I'm going to send you 2 others that I know of. And we're going to keep our promises to keep our trusting relationship with our folks. Okay. I think I'm going to keep moving because we've had lots of questions and comments, and we will continue to do that. But for today, I am going to wrap us up with some other really great resources. So one is the CTI, or the Critical Time Intervention Assessment Domains. So this is a great clinical map. It's the assessment domains that give you kind of like a structured way to look at each area of a participant's life that affects their housing stability, not necessarily just the obvious ones. You want to use it regularly, not just at intake, because we know that things change, and we want to revise this and keep revisiting this so that you can try to see what's happening and look at the risks before they become crises. There is a housing and community stabilization plan, and this is the document you're working with the client, goals, roles, supports, timelines, and it operationalizes all the different things we've talked about today. To make sure you're taking a look at that, because it's a really important resource. And then there was an article, Principles of Harm Reduction, which is a foundational read that goes much deeper on harm reduction and the framework we covered today. So check out those resources. And then
I did put the slides in the chat, and these links are live, and
Yes.
and will take you directly to the resources. So if you want to just grab the link to all the slides that Liz and I have walked through today, you'll have access to these links.
That's great. And then the last slide is just the most important thing, the supports, the great folks that you guys have from Rhode Island COC, that you have Rosa and Sarah, who do tremendous work. So obviously be in contact with them. You always want to be in touch with your HMIS folks, because we know HMIS is important and we need data to make it all work. And I'll do a plug for their office hours. Check it out, because that's a great way to problem solve with them. And then you have the HI, or Housing Innovations team, Matt, Sarah, and you have me. Please reach out to us. We love to chat with folks. We love to answer questions. And I'll stop there.